Now that we already have a background on Parkinson's disease, we will now uncover the clinical manifestations, diagnostic procedures, as well as the nitty-gritty of the pathophysiology of Parkinson's disease. In order to clearly identify Parkinson's disease in patients, some key hallmarks must manifest. The most common clinical manifestation is that of trembles found in the hands, arms, legs, and jaw, as well as bradykinesia. It is also accompanied by other signs such as impaired balance and stiffness of the body.
So yung cardinal symptom ng Parkinson's that all patients with Parkinson's will experience will be a decrease in movement or a paucity of movement. In a, let's say for example, on a chair, so they will maintain in that posture for a long time without moving his hands or his feet. Tapos walang facial expression. And then, in 70% of the time, the initial symptom will be a tremor.
As for the organs affected by PD, the brain is the main organ affected. As for which specific part of the brain is chiefly affected, that would be the basal ganglia. These cells are responsible for basic motor functions of individuals. As such, in patients with PD, these cells are found to be either damaged or dead, which causes all of the previously stated clinical hallmarks associated with persons with Parkinson's disease.
But in Parkinson's disease, the problem actually lies in one of those two control systems that I mentioned earlier. So either the basal ganglia or the cerebellum. So di ba yung corticospinal tract is supposed to be under the control of the basal ganglia for you to actually maintain your posture whenever you perform an action, or to maintain the smoothness of a particular action and help you also initiate the movement. So since nawala si basal ganglia because of degeneration, because it's considered to be a neurodegenerative disorder, then nawawala from the control yung corticospinal tract. That's why you have all those involuntary movements.
By now, we have an inclination as to how complex Parkinson's disease is. Although a lot has been already known about the disease, there is still so much we don't know about it. In fact, until this time, PD is still considered largely idiopathic, meaning of unknown cause. Physiologically, the symptoms associated with Parkinson's disease are a direct consequence of the loss of number of neurotransmitters, most notably dopamine. Symptoms worsen over time as more and more of these cells affected by the disease are lost. The course of the disease is highly variable, with some patients exhibiting very few symptoms as they age and others whose symptoms progress rapidly. With this, Parkinson's is increasingly seen as a complex neurodegenerative disease with a sequence of progression.
But it's a degenerative disorder. By degenerative, meaning slowly progressive na nasisira ang different parts of the brain. So it does not only include basal ganglia. So di ba ang basal ganglia yung Parkinson's eh. Pero since it's a degenerative disorder, you can also have degeneration of the other parts of the brain in the future, at a later stage of the disease. So kaya nga yung iba nagiging demented din.
Making an accurate diagnosis of Parkinson's disease can be complicated, as there is no conclusive screening or laboratory test that can indicate that the patient has Parkinson's.
Unfortunately, there's really no test that can determine or diagnose Parkinson's disease. So yung diagnosis ng Parkinson's disease is actually purely clinical. So makikita mo lang siya. So like if you're trained to actually look at patients with Parkinson's, pag nakita mo yung mga symptoms, you should know the different symptoms that you would want to look for, and then if the symptoms fit into the patient, di ba? So the patient has all those symptoms, then you come up with the diagnosis of Parkinson's disease. The best diagnostic criteria actually is the response of the person to the medication. So there's really no diagnostic test to confirm or help you actually diagnose definitely Parkinson's, but the response to treatment, will give you a clue as to whether you're really dealing with Parkinson's or maybe you have another disorder.
To understand the pathophysiology of Parkinson's disease, we must first know the normal pathway of neural signals coming from the cortex of the brain all the way down to our skeletal muscles. The overall effect of the basal ganglia is to coordinate voluntary movement using excitatory and inhibitory signals. To conduct coordination of movement, we have two neuronal pathways: the direct pathway, which initiates movement, and the indirect pathway, which terminates movement, both of which involve excitatory and inhibitory signals. In the direct pathway, we start with the motor cortex sending excitatory signals to the striatum or the caudate nucleus plus the putamen. The striatum then sends inhibitory signals to the globus pallidus internus. The globus pallidus internus sends inhibitory signals to the thalamus, and the thalamus sends excitatory neurons back to the motor cortex. The net effect of this direct pathway is to turn on the motor cortex, which ultimately leads to the contraction of muscles through the spinothalamic tract. For the indirect pathway, similar to direct, it starts first from the motor cortex sending excitatory signals to the striatum. The striatum then sends inhibitory signals to the globus pallidus externus, which makes the difference from the direct pathway. The globus pallidus externus will send inhibitory signals to the subthalamic nucleus, and in the subthalamic nucleus will send excitatory signals back to the globus pallidus internus. At this point, the indirect pathway finishes the same with the direct pathway, sending an inhibitory signal to the thalamus, resulting in the inhibition of the motor cortex. The net effect of the indirect pathway is to turn off the motor cortex, resulting in the relaxation of the muscle. This is what makes our movement coordinated. Some muscles must relax and others contract to conduct a specific movement. Now, how does the substantia nigra contribute to this? The substantia nigra is the main region of the basal ganglia responsible for Parkinson's disease. It is located in the midbrain that synapses to the neurons associated with the direct and indirect pathway of the putamen. In those synapses, we have a dopamine receptor called D1 for the direct and D2 for the indirect pathway. Since the substantia nigra releases dopamine through these receptors, the effect of dopamine is to increase or enhance the turning on of the motor cortex, thus increasing muscle movement. In Parkinson's disease, reduced dopamine input from the substantia nigra to the striatum leads to inhibition of the direct pathway and increased inhibitory drive of the thalamus, ultimately leading to decreased excitation of the cortex. These explain the clinical manifestations of hypokinesia and bradykinesia of a patient with Parkinson's disease. Events leading to the neuronal cell death of the substantia nigra are poorly understood, but the presence of Lewy bodies in the neurons suggests that these are the pathological hallmark of Parkinson's. Lewy bodies are misfolded proteins with alpha-synuclein as its main component. Photomicrographs of regions in the substantia nigra in a Parkinson's patient shows these abnormal aggregates may contribute to the degradation of the substantia nigra. On our next episode, we will discover medications and preventions for this neurodegenerative disorder, so stay tuned for the next episode.